I became a sedation dentist for one reason only, was that when I was a child at 5 years old, I went to a dentist and they didn't use any anesthesia at all. And I remember the experience very vividly. I decided that there was no way that I ever wanted to put the patients through the experience that I had. I have used sedation in dentistry since 1973, and I've done over 4,000 cases. There are very few licenses in the state for this kind of a procedure. It's a long internship program to get the qualifications to apply for the license, and I am, at this point, the only dentist in the Snohomish County that has the license to do it. There are a lot of people out there that call themselves sedation dentists, but they take a weekend course on how to give somebody a sleeping pill. Consider this: if you were going to your doctor and you were going to have your tonsils out, he's not going to give you a sleeping pill to take your tonsils out. He's going to do IV sedation. The sleeping pill obviously just makes you sleepy, and that's exactly what it is. Some people fall asleep, some people don't fall asleep, and some people it doesn't even work for them until after they leave the clinical setting. Whereas with intravenous sedation, it's a controlled response. We control the drug dosages. It's immediate onset, and it's a very smooth transition between unconsciousness and consciousness. It has a great amnesia effect. You can be sedated for 2.5, 3 hours, and it seems like you've been in the clinic 15 minutes. The sleeping pill's duration is usually 6 to 8 hours. The patient feels pretty uncomfortable afterwards, and there's not the safety, nor is there the ability to control the effects. And if something happens with an IV sedation, you can always put a reversing drug in and bring the patient out of it. That is not necessarily so with the pill form. They have certain areas of discussion with using the pill, but in my opinion, it's not as safe or as controllable as the IV sedation. What I really look forward to is working with patients and helping them overcome their fears, delivering the dentistry, making their lives better. I don't believe in doing production dentistry where you jump up and see one patient, you see another patient, you get the next patient numb, you go in and do a filling on somebody else. I work with the patient from the beginning of the procedure to the end of the procedure. I do not get up and leave that patient at all. I like working with people one-on-one. That's the way I would like to be treated. And I'm very meticulous about how I do it. I'm meticulous about the materials I use and the procedures, and also the staff I hire to help me do the dentistry. I think that in all of this, the most important part of dentistry is the relationship between doctor and patient. People need to be heard for what their fears are. They need to recognize that it's not just them. Other people have the same fears, same trepidation, and we're all in this together, and the main thing is to get the dentistry done as comfortably as possible in as little time as possible.